To us about colon cancer today. Colon cancer, as you all know, simply means cancer that starts from the large intestine extending to the anus, usually called colorectal cancer. That means a combination of the colon and the rectum. In 2016, an American actor, Chadwick Boseman, was diagnosed with colon cancer just at the age of 39 years. He had a series of surgery done and also chemotherapy. However, he died about 4 years after. What are the facts about colon cancer? Colon cancer is the third most common cancer in the world, and it is the second most common cause of cancer-related death. Colon cancer is quite common in developed countries due to the sedentary lifestyle. It is highly treatable when caught early. However, early stages of colon cancer do not usually present with symptoms. What are the symptoms of colon cancer? They are quite numerous, but the usual presentation are abdominal pain, which is stomach pain. Second is changes in bowel habits, which is a persistent period of constipation and diarrhea. When you start having constipation, then diarrhea, so you should suspect colon cancer. Unexplained weight loss is also a common symptom. Loss of appetite, generalized body weakness, then having to see blood in the stool. What are the risk factors of colon cancer? They can be grouped into two: the ones that you cannot change and the ones that you can change. The ones that you can change are the modifiable risk factors, which include our diets. People that consume high fat, less fiber diets, consumption of red meats or processed meats, then physical inactivity, obesity or overweight, smoking, and heavy alcohol intake. The risk factors that cannot be changed, which are the non-modifiable risk factors, include age. It has been shown to be common in people above the age of 50 years. Then family history, people that have first-degree relatives, such as the father, the mother, or any of the siblings that have colon cancer, are also at risk of having this condition. Then genetic, there are some genes in our body that predispose some individuals to having colon cancer. Then having a previous history of colon cancer also puts you at risk of having colon cancer. Another factor that you cannot change when it comes to colon cancer is our sex. It has been shown to be commoner in male than female. So that's why you see a lot of men presenting with symptoms of colon cancer. How do we prevent colon cancer? It is quite important that we take measures to prevent us from having colon cancer, as early detection is the goal. Firstly, diets. We need to ensure that we take a lot of high fiber diets and low fat intake. High fiber, I mean a lot of fruits and vegetables, then grains. Then it has also been shown that reduction in the consumption of red meats or processed meats, especially when you are above the age of 40 years, it has been shown to reduce the risk of colon cancer. Then physical activity. It is recommended by the World Health Organization to do at least 30 minutes of physical activity every day on most days. It is recommended for 5 days in a week. That is 5 out of the 7 days. Then avoid smoking as much as you can. Limit alcohol intake. Lastly is to get screened. Screening of colon cancer involves undergoing a procedure we call colonoscopy. And also, do not ignore the symptoms that I mentioned above. What is colonoscopy? Colonoscopy is a camera test which involves passing of a long, thin, flexible tube through our anus in order to visualize the colon, that is the large intestine, and then the rectum. This helps to detect if there are any changes along the wall of the intestine, or if there's any mass or any tumor that can be easily picked and checked under the microscope, which we call biopsy. So who are those that should be screened with colonoscopy? Everybody above the age of 45 years is encouraged to get a colonoscopy done. By doing this, if the result is negative, then to do a 10-yearly screening check. That means you should be doing it every 10 years if the result is normal. However, if there are some changes along the wall of your intestine after doing a colonoscopy, it is encouraged to be doing it every 3 to 5 years. If you are now a high-risk individual, by high risk I mean people that have all the risk factors you have mentioned, you are meant to be doing it as much as possible so as to detect any changes for early treatment. Colonoscopy as its way is not a painful procedure. It helps to detect cancer early for easy treatment, and also it has lower chances of complication.